The listening part of the occupational English test has 3 parts, and in each part, you will hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You have time to read the questions before you hear the extracts. You will hear each extract only once. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 different extracts. In each extract, a healthcare professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a neurologist talking to a new patient called Mrs. Lizaveta. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, doctor.
Good morning, Mrs. Lizaveta. Could you tell me what the problem is?
I have a mild gait impairment and cognitive slowing, doctor.
What's your age?
71, doctor. I think I walk in a funny manner. Actually, my husband has noticed this over the past 3 months and says I have broadened my base and have developed stooped posture. My balance has also started declining. I have to use walls or furniture to stabilize myself. However, I'm not using any kind of assistive device.
So what about your bowel and bladder movements?
I do not have any issues, doctor. No frequency, issues, or urgency.
Do you have any headaches?
No, doctor.
Have you experienced any change or decrease in your memory or thinking?
It is not as smart as it used to be earlier. However, I am able to pay the bills. My thinking has slowed down. I often get stuck with the words when I speak.
Have you ever had any trouble with syncope or vertigo?
I don't have any trouble with syncope, but I've had some episodes of vertigo. I was diagnosed with hypertension in 2014, but no snoring or apnea.
Any other complications?
I've had arthritis since 2000 and thyroid abnormalities since 1975.
Have you had any surgery?
Well, I had a hysterectomy in 1992 and a wrist operation after I fell down in 1972 with a titanium plate and 6 screws.
All right, can you give me a brief history of any illness in your family?
My mother had colon cancer.
Are you allergic to any medicines?
Yes, codeine and sulfa.
What medications are you taking now?
Premarin, 0.625 milligrams, Acifex, 20 milligrams daily, Toprol, 50 milligrams daily, Norvasc, 5 milligrams daily, multivitamin, Caltrate plus D, B-complex vitamins, calcium and magnesium, and vitamin C daily.
Well, after reviewing all of your medical reports, I doubt that you've developed adult hydrocephalus. Your diagnosis reports show blood pressure 154/72, and your heart rate's 87, and the weight 153. And your pain is 0 out of 10. Your spine is straight and non-tender, and you have very mild kyphosis, but no scoliosis. And your gait assessment shows that you have some unsteadiness and a widened base. I've reviewed all your x-ray reports since 2009, and it shows a mild ventriculomegaly with trace expansion into the temporal horns. The Sylvian aqueduct appears to be patent. Your corpus callosum appears to be bowed and effaced. You have developed a couple of small T2 signal abnormalities, but no prominent changes in the paraventricular signal. I should have your cerebral spinal fluid leakage tested through lumbar punch method. With this test, I can assess your response to shunt surgery. There is a mild risk of meningitis of 2 to 3%. Extract 2, questions 13 to 24. You hear a physician talking to a patient. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, doctor.
Hello, Jamila. Can you brief me about your health issue?
Yes, doctor. Actually, I approached a physician about my abdominal pain 8 months back. On my chest x ray, I had a possible infiltrate, and he thought that I might have pneumonia, and I was treated with some antibiotics and prednisone. However, the symptoms improved for a short period only, and it didn't cure my disease completely. Besides, my pain had worsened by the end of the month, and I was admitted to an emergency ward. This time my chest x-ray was compatible with pleurisy, and I was treated with Percocet. However, I was given another prescription for Ultram since I had nausea and was vomiting with Percocet. Eventually, I was referred to another doctor and was diagnosed with splenomegaly. A repeat ultrasound showed an enlarged spleen of 19 centimeters. My positron emission tomography scanning showed diffuse hypermetabolic lymph nodes of 1 to 2 centimeters diameter and an enlarged hypometabolic spleen. Finally, I had my lymph node biopsy on the right side of my neck last month, and mantle cell lymphoma was detected. 2 weeks ago, I had a bone marrow biopsy that showed involvement of bone marrow with lymphoma and also circulating lymphoma cells on peripheral smear.
And your age?
45, doctor.
Okay. What medications are you taking?
Estradiol, prometrium, 200 milligrams, Ultram whenever I get pain, baby aspirin, Lunestra for sleeping, and iron supplements.
Are you allergic to any medicine?
No, doctor.
Tell me about your previous medical history.
Yes, doctor. I got my tubal ligation in 2001, and a cyst from the left side of my neck was surgically removed in 2005. I had tonsillectomy, and I get occasional migraines.
Do you smoke or drink?
No, doctor.
May I know your job profile?
Well, I'm working as a project manager.
Tell me, is there any family history of diseases?
My father had emphysema and colon cancer when he was 68, and my mother has hypertension and arrhythmia.
Well, your heat diagnosis shows the oropharynx is benign. There is shoddy adenopathy in your neck, though, and your abdomen is soft and non-tender and shows the palpable spleen approximately 10 centimeters below the right costal margin. Your mantle cell lymphoma is confirmed, and I would advise that you should go for chemotherapy with hyperfractionated cyclophosphamide, dexamethasone, doxorubicin, and vincristine. Discontinue aspirin for now and continue estradiol and prometrium. Take Ativan as and when you feel anxiety. You'll be given allopurinol from today and hydration further so that you can avoid tumor lysis syndrome. I will plan to add Rituzan a little later on in your course since you have circulating lymphoma cells, and I'm planning to get you evaluated for bone marrow transplant in first remission. That is the end of Part A.